Hi everyone, welcome to another live session with Gravitas AI. And with us today, we have some very interesting panelists, and we are going to be discussing a very interesting topic, which is value based inclusive healthcare with AI. Now, in this particular discussion with me, I have Dr. Shuchin Bajaj. He's the founder director of Ujala Cygnus Healthcare. Welcome to our live session, sir. How are you doing today?
Thank you very much. I am very good and very happy to see you. Uh, Hope to have a great discussion today with Mukesh ji. Thank you for having me again.
Thank you.
Thank you so
Thank you,
much.
sir.
And with us, we also have our very own Mr. Mukesh Sinha. So Mukesh sir is co-founder Gravitas AI with a lot of pedigree in healthcare industry, especially ophthalmology. And he is one of our favorite panelists here with Gravitas AI live sessions. So thank you for being here and participating in the panel, sir.
Thanks, Sneha. Thanks a lot.
Okay, great then. After this quick introduction, let's dive into the interesting topic of value that are included in healthcare when we are looking at different AI tools that are being incorporated. So my opening question is to you, Dr. Sachin, that what are the key challenges and opportunities of using AI to advance, say, uh, value based inclusion of healthcare. So, are we looking at only challenges or are we looking at only opportunities, or it's a balance of both?
Yeah, Sneha, like everything else, I think it is a very good balance of challenges and opportunities. I think the key challenges that we face on a daily basis is first of all the data availability and quality. So in India, we I think treat the maximum number of patients. Our surgeons have the maximum number of surgeries, but the problem is there is no data throughput. The number of publications of data on the number of randomized controlled trials that we do, the availability of data is very limited, and the data that is available is not very high quality. First is, of course, is to make sure that how do we use AI and machines to make sure that there is availability of quality data which is trustworthy. Once we have that data, we need to make sure that there is data security and privacy around it. So we cannot have that data, keep collecting data without making sure that it is secure. Once we have that, we need to make sure that there is no bias and it is completely fair on how we are processing the data so that the quality is maintained. And then we need to integrate it with the existing systems, making sure that there are no regulatory and ethical issues, and also making sure, because India is a very price sensitive market, making sure that cost and resource constraints are addressed at the very outset. We cannot really gold plate our offerings and make sure that we are offering very good value for money. So around that, of course, is the opportunities that lie, that we can do a lot of personalized medicine. We can raise the efficiency and productivity of all our doctors and our staff, thus improving patient outcomes a lot. And if that happens, we increase the accessibility and the inclusivity around our offerings. We can go and offer to the last mile what we are currently doing only in the big cities. That leads to a lot of cost reduction, lots of research and innovation, and much better and enhanced decision making around our offerings. So once we address those challenges I talked about, availability of data, quality, security, privacy, regulatory and ethical issues, the opportunities are quite endless and limitless according to me.
Right. I think you've covered a very broad spectrum of things, that do pertain to, say, challenges that are, currently there in healthcare. Mukesh sir, what would you suggest, in terms of any challenges that you have come across, also being looking at the kind of products we have at Gravitas AI, we've been working with so many different healthcare institutes. So of course, you must have first-hand experience. So anything that you would like to share with us in this space?
I would say entire healthcare, whether it is in India or at global stage, it is going through the transformation stage, particularly post-COVID. And Dr. Suchin has rightly mentioned, particularly as per AI is concerned, data quality and safety and privacy. That is the most important parameters to have any new technology integration with the healthcare segment. Hello.
Yes, sir.
Sorry, I think it's connected, or I'm.
Yes, sir. You're live and
Yeah,
active.
sorry.
You can go ahead.
Okay. So, yeah, so Dr. Suchin has rightly mentioned the data safety security is the most important parameters. And as for India is concerned, it's a demand versus supply. That is the issue. So AI can definitely help in terms of improving the system, getting the diagnostic with the data driven, much accurate, and even the decision making process can be much better with the AI. But it has to be the quality of the data, and of course this integration through all the complete ecosystem, so that it can be trustworthy and get the access much better, smoother than compared to right now in coming in a patches.
Correct.
So it's,
Correct.
I would say it's a like a lot of opportunities. It's the endless opportunities, but there are few challenges that need to be addressed. And regulatory can play because so many companies are coming and they're claiming they are the best. But regulation is being a clinician. I think Dr. Suchini, you will agree with that. Regulation is going to be very, very important for the future as far AI healthcare is concerned.
Correct, correct. So I think regulatory measures is something that the government as a whole needs to look into, especially when it comes to healthcare. Because it's so sensitive in terms of information that is being shared, so on and so forth. Now moving to Dr. Suchin again, can you probably help us understand a successful case study or a particular implementation of an AI tool that happened in say Ujala Cygnus or any other institute that you have seen, which really improved, the whole setting of your management in terms of healthcare. So, is there a success story or is there an inspirational story that you can share with us?
There are many actually, Sneha. So, I have, and I'm sure Mukesh sir will agree with me. We've grown up in times when even having a phone was a luxury, right? So, when I started out, I used to go to the hospital very frequently in the middle of the night at 3 a.m. because the resident had a patient who had some sort of chest pain or stomach discomfort, which the resident couldn't really understand what it was. And they could not even understand the ECG properly, saying that there is something in the ECG which we don't know. And transmission of images was unheard of at that time, right? Like, to even get an image, process it, and see it yourself used to take at least a week, right? You had to click from a camera and then give the role for film development, and the role would come back after a week. So it was unthinkable that someone could see the ECG and transmit it live to you. So I used to go up, get up at 3 a.m. in the night and then go to the hospital and then see that the ECG was perfectly normal and the patient was having just gastritis. So I've started my work from those days, and it is, I mean, quite unbelievable. A person growing in these times and ages would not ever believe that these things were a luxury or unthinkable now. So right now, and a person can just click a photo of the ECG and send it to you on WhatsApp immediately. So we've implemented a lot of these technology initiatives. Some of them are very heavily dependent on AI. Some do more of machine learning and less of AI. So the first one that we did was the ECG interpretation. So we implemented in conjunction with another organization and supported by the World Bank, a project where we installed ECG machines in small villages and clinics around the hospitals that we have. So we have 22 hospitals across 5 states, and most of these, all of these hospitals, in fact, are in small towns, district headquarters, and the villages and the kasbas around these head, the hospitals, they are very very underserved in terms of healthcare needs. So our district hospital has a cath lab and a cardiac intervention center, and some of them also have cardiac surgery centers. Uh, and these kasbas and small towns, we installed these ECG machines where the practicing doctors, once they did the ECG was immediately transmitted and interpreted by a machine to see whether it was a normal ECG or not, because it's very difficult for these Kasba doctors to interpret ECGs. As I told you, the residents earlier could not. And if this is a normal ECG, it just goes back the report that this is fine, don't need to worry. But if it is a abnormal ECG, a heart attack is happening, or some sort of rhythm disturbances are happening, it is then scaled up to a cardiologist who sees and confirms that okay, this is a problem. And sometimes we would call that doctor, right? Because then the ECG report would come to us, and this all happened within a matter of say 30 seconds or less than a minute, less than 60 seconds every time that the ECG was interpreted and sent, the report was sent to us. And we would call that doctor that, there is a heart attack patient lying in your clinic and these are the things you need to do, and we are sending an ambulance for that patient. So the doctor was not aware. So that led to a lot of prevention of preventable deaths, because we could initiate treatments in time. That also led to revenue increase because we were now getting a funnel for our cardiac services from these small towns and kasbas. And that led to an increase in practice for that local doctor as well, because now patients were like, oh, that doctor has direct communication and these fancy machines that can actually inform you well in time. We also started a project with retinopathy. So India is the capital of diabetes, as we all know, right? We have more than 70 million diabetics. And due to the late diagnosis and interventions, we have the almost the highest rate of complications in the world. So we know that out of the 70 million diabetics we have, more than one third of them will end up into kidney failure just because of mismanagement and poor control of diabetes. We are amputating almost 1 foot every minute due to diabetic gangrene and diabetic foot complications. And we have very high retinopathy rates as well, the eye complication rates. So diabetic foot you can diagnose by seeing it. The doctor can actually diagnose it. The diabetic nephropathy also, blood tests are easily available. But diabetic retinopathy, very difficult to diagnose because it needs an ophthalmologist to see your fundus, do the retinoscopy, and generally doctors are not very well equipped to do that. So there is this camera which can be fitted easily into a smartphone, and if you just take a photograph of the eye with that smartphone, the AI can actually read it very quickly and tell you whether the diabetic retinopathy is happening in the eye or not, and whether the patient needs specialist ophthalmology consult or not. So that leads to great interventions in the screening tools that we have. So we also have a AI based chatbot that patients can reach out to in English or Hindi, and we have a dedicated number for that. So patients can just reach out to that chatbot and just have a language learning model kind of an interaction. You don't need to be very clear that you press one or press two. You can actually say just I want my reports, and the chatbot understands that you are asking for the blood reports that you were tested for yesterday, and it can pull out the reports from our hospital management system and get it to the patient. The system can book appointments, the system can arrange a teleconsult for you. So all of that, it becomes very easy then to reach out to us rather than going physically to book appointments, etc. So we are very bullish on implementing technology, because I personally feel that any investment into technology actually saves you money. It's not a cost center, it's a profit center for everyone. The
Hmm.
problem that most hospital owners have is that they feel that technology is too expensive. No, this will cost a lot, but in the long run it saves you a lot of money, right? So uh, you're having a feature phone may be cheaper than buying a smartphone, but the fact that you can talk on WhatsApp for free and send images for free on WhatsApp, I mean, that will in the long run save you a lot of money on
Correct.
communication costs, right? So the initial investment may be there, but in the long run it definitely pays you off a lot more times.
Right. Mukesh sir, would you like to add anything to this from your side?
Yeah, so he has a live example we have seen, and I am aware about the Ujala Cygnus kind of the work they are doing it, particularly in B class, C class town. That's very impressive work, sir. But the biggest example for the whole of the world when COVID was there, everything was standstill, but only one sector that was up and running and most on the demand is the healthcare sector. And it was be able to sustain. The reason behind, we have some technology integration. In general terms, people talk about the telemedicine, right? At least you can able to connect either through your smartphone or through the telemedicine. That was the biggest example. And of course, one of the biggest, he had just mentioned about diabetic retinopathy, because from industry side, I am aware about Google has invested a lot money with doing studies at Arvind Eye Hospital, Shankar Nethralaya hospitals, and that only not detect the early stage of diabetic retinopathy. Even you give a lot of other things in early stage, like early stage of cancer. That is also one of the very important early stage of something is happening in heart and other thing. So it's really help a lot, and peoples are already experiencing across the sector. So, and now we have not only is limited to the metro cities. Now peoples are implementing across the cities, whether it in India and even outside India. So definitely a lot of a success story, but it is just now in early stage. Potential is huge. So that I would say. And another very great example he has mentioned about the chatbots and other thing. So you are giving 24 into 7 authorized information, because in Google you have a lot of information. So it is good for the general but not for the healthcare unless until it is approved by the trained doctors or certified doctors. So in chatbot you have authorized information, regulated information, so patient have can access the information 24 into 7 at the convenience, and many of the things can be time, and the in fact treatment can be reduced because of this automation. So these things are very
Right.
common, and a lot of success story. And you are aware, in the Gravitas we are one of the pioneers as for the healthcare chatbots is concerned.
Right. Right. So I think we have very rightly discussed how AI can also look into patient engagement, and also how are we trying to help, say, underprivileged uh, populace with something that is maybe for them it's far fetched, like Dr. Sachin has rightly mentioned that for them looking at a machine that can evaluate their healthcare status and give them a preventive measure instantly and conveniently, and also having a tie-up with a larger healthcare setup like Ujala Cygnus, where they get further redirected for their treatment, is a very nice setup and something that is very, very innovative from your end. But also, do you see, are there any misconceptions or myths around, how AI is going to help? So, do you see that healthcare professionals are actually kind of caught up into discussing these myths or these misconceptions? So, are there any preconceived notions that are there, and is there something that you have faced from your end as well?
I think the misconceptions and myths are too many to to enumerate. But yeah, the biggest misconception and myth that we notice most is, that we will have a Terminator-like organism coming in very quickly. That will make decisions and take actions on their own without any human interventions, and soon we will have them overrunning the entire world, and humans will be irrelevant. So I don't think that will happen. The first myth, again, as I said, AI and technology will replace healthcare professionals. I don't think that's true. What is definitely true is that healthcare professionals that use AI and technology will definitely replace healthcare individuals who do not do that. So the professionals that are stuck in the older times will be left behind, and the more savvy of them, the more technology friendly of them, who help, get help in decision making, will definitely progress and be more successful. That is something that I really feel is the truth going forward. So any doctors or nurses or paramedics who still feel that the technology is not for them, or it is, too complex or too new, uh, will be in for a tough time in the future, as quick as 1 or 2 years down the line. The second most common misconception leading into this conversation only is what I've heard from doctors, etc., is that AI is too complex and too complicated for practical use, which again I feel is mythical. So the simplest example I give them is that, look at your own children. So most of them have young children, 3 years, 4 years, and look at your own children, how they are operating their iPads and their, phones, and they're all the time hooked on that. So it's not that the children of this generation are smarter. The credit doesn't go to the children that they can operate the iPads and the phones so easily. The credit goes to the engineers who made these devices and machines. They made them so simple that, anybody, even a 2-year-old child, can operate them very easily. So healthcare technology is in for a similar transformation, and already many of it is coming in very clearly. As I said, the AI chatbots that we have earlier, when, as I said, when I was growing up, and I always mention these things and people think I'm like really old, like a 75-year-old man. But when I grew up, operating a computer was very difficult. You had to know basic, at least, if not C or any other language, Java. To input just a command, you had to know that there is special command had to be inputted into the computer. The computer won't understand like normal things till the time Windows came in and you could just click and operate things. Earlier, in my time, we had a green color monitor, and we had to input a special command to make the computer understand us. So those things are, so I think similarly in healthcare also, I mean, AI chatbots, even a very lay person with a very minimal level of education can operate that chatbot and get access to all kinds of medical information and authorized information, as Mukesh ji said. So things are going to only get simpler and more integrated into our lives. Third myth, which again is related to this, is people say that, AI induces bias and exacerbates inequality in the world. People who are technologically friendly are, much higher in the world system than the ones who are not. uh, to a certain extent it may be true, but I feel that AI and technology have actually democratized the system much more. Patients now have access to much more knowledge. They are much more informed and thus lead to better decision making in healthcare access, which earlier all information was held in the ivory towers of us doctors, and we used to share it at all with the patients, and we used to make all the decisions for the patients without even asking them, and the patients had no choice practically but to agree with the doctor. That, the doctor said, now you have to have an angioplasty, and the patient said, okay, yes, I mean, I have no power in that. But now they have access to a lot of information real time, and they can make better decisions. There's a lot of transparency now in the way that things are done. We have to, have records in place. Everything has to be accessible. There are regular audits, and as I said, data is leading to a lot of equality around the world rather than inequality. So I think these myths will soon be busted completely, but I thought I would do my bit to make sure that people hearing this
Right.
feel, AI is driving inclusivity and equality rather than the other way around.
I think it is very refreshing to uh, actually listen to these kind of uh, facts from someone who comes from a medical background, and you being in and around you know representing India at so many global conferences and speaking for India. I think when someone like you speaks up about myths, it really endorses the technology. It really puts it on the front gear. So, and I totally agree with all that you have said. Mukesh, sir, is there anything that you would like to add to these myths? So, I think we've primarily addressed the top three myths, but is there something that you have come across and you'd like to highlight?
I think I'm fully endorse Dr. Suchin view because he has seen how the technology is evolving and getting accepted day by day. Uh, and a very powerful statement from you, sir. In fact, technology or AI helping democratize and inclusive healthcare. So that is the biggest things there, and particularly for India kind of setup where demand versus supply is huge. A lot of patient versus doctor ratio or paramedical staff ratio is always a challenge. So AI is rather helping them complement their work day to day and making the things system more efficient. Next, very important thing, uh, initially people feel that it is a cost, but you are rightly mentioned it's a not cost, it is a profit center. Initial, of course, entry costs are there, but if you see over a period of time, and so it's not like a 5 years plan, another thing, within a year you are achieving more than what you are expecting from such kind of technology. And particularly for implementation, many times being from the industry side, we do get the entry with talking to the highest authority of the hospitals or decision making. The biggest challenge I see when we are going to implement day to day, it's a lot of pushback from the admin person and because the myth you are rightly mentioned, it will replace. So we have seen it's not replace, it is going to complement day to day work. So rest other things, I think he has given many live examples. So and it is evolving, so over a period of time it is going to be more effective and more simpler to use anybody anywhere, because we have a customer just place like a remote area like Malda we have, then we have another example somewhere in the Jamshedpur. So even the peoples who had just a little bit knowledge how to operate the smartphone or any other thing, they can use this technology.
Correct. Correct. Uh, uh, I think we've very fairly discussed a broad scope of all the myths, and Mukesh sir and Dr. Sachin has really put forward uh, a lot of questions that we have in our minds, but we don't get answers to. So thank you so much for bringing that up. Moving to our last question. Do you see any future developments in AI that are going to be groundbreaking? And do you anticipate any kind of value that it is going to add, not only for healthcare when it comes to healthcare when it comes to affordability of healthcare, right? So, we being in metro cities, for us, the affordability of healthcare is a different concept altogether. But when we look at a underprivileged strata, the affordability access to information and healthcare is a complete different ball game. So, how do you see these future developments? Not only participating in betterment of, say, delivery of these services, but also, do you think there would be kind of a knowledge transfer that will come along with it? So, any thoughts on that?
So, see, the thing is, healthcare is now the only industry that has not been changed to an unrecognizable industry after the
Correct.
advent of technology, right? So I remember a conversation with one of my very dear friends about 10 years ago, I think, or 15, 12, 13 years ago, quite a long time ago. She was heading the Wyndham group of hotels, Asia Pacific at that time. And she was like, see, Shuchin, you and I are the only industry that has been left, quite unchanged, because hotels will be hotels always, right? And hotel, basically, what do? You provide a safe, neat, and clean place for the person to stay the night. That is what we have been doing for 2000 years. That is what we'll keep doing for the next 500 years. Technology will not change us, and neither will it change you. I mean, hospitals are meant to treat patients. You will keep treating patients. That is what you've done for thousands of years. And rest, every industry will change. We will not change. And so I said, yeah, okay, maybe. I don't know, but let us see. So 1 year down the line, then she came back and said, oh, technology has changed us completely. No, no, now I know how technology can affect us. Earlier, we were adding like 300 rooms uh, in a year, but now we are adding like 600 rooms a year, because with technology, we can close our pipeline quicker, and we've stopped buying hotels. Now we just take everything on rental and everything, and we have doubled our room capacity every year. And this is what one. I said, I mean, maybe that's correct, but that's not really what technology is. I mean, but okay, I hear you and agree. But she said, no, no, then how much can technology affect us? It will be the same. And when we had this conversation, precisely around, say, 3 months later, Airbnb came in and they opened their Paris office, I think, with one and a half people, one full-time employee, another intern who was in and out, and I don't know if he was all coming in or not. And within 10 days, I think they had added like 11,000 rooms or something in France for themselves, right? So, and then I talked to her, said, look, this is what technology can actually do, right? For 300 rooms, 600 rooms, you have like, in a year, you have 11,000 rooms here in a week. And then she was, yeah, like zapped completely. So the hotel industry changed with Airbnb. The commerce industry has completely changed with e-commerce coming in. I mean, I don't know if you remember this, but 10, 15 years ago, if somebody had told you that you can buy a dress without even touching the fabric or seeing the actual color or trying it on, just in the comfort of your own house. I mean, these things were reserved for Rajas and Maharajas, that the shopkeeper came to their house to show them the, things, and they would buy. Otherwise, us mere mortals had to go to the market to buy now. So, banking has completely changed. I remember my father used to take me, and in those times, banks were not closed on Sundays. So banks were closed in the market, wherever the market was. If the market was closed on that day, the bank would be closed. So Wednesday, if the market was closed, bank would be closed on Wednesday, because of security reasons, that they didn't want to keep themselves open when the rest of the market was closed. So our local bank was closed on Wednesdays. It was open on Sundays, and I remember very clearly that Sunday was the only day when Doordarshan used to show some cartoons or programs. And my father would drag me to the bank that we have to get our passbook updated. Let us go, both of us. So I used to spend the entire Sunday morning with my father in a bank because he had to get some paperwork done. I don't remember going to the bank for the last 6, 8 months or a year. I don't know when I went to my bank last. So every industry has been transformed into an unrecognizable form from what it was, say, 5, 10 years ago, except for healthcare. It had started to change in COVID a lot, because, as Mukesh ji said, the OPDs, at least the primary care consultations, became completely online during that time. But again, they've switched back. So we have almost 80% of our consults online during COVID times. Now they're less than 5% again in our organization, which has changed. So it's not been sticky. But I think there is something that will change it. We are at the cusp of the revolution, because we are the last ones here, right? Standing in the brick and mortar structure. So it is going to change. I was talking to a founder of a organization just day before yesterday. They have an organization which is doing now 8,000 teleconsults every day. 8,000 every day, which was unheard of. So that will lead to much lesser costs, as I said, much better reach for doctors. And once we start having that data collection, as I said, which is reliable, the cost of the disease will keep coming down very rapidly, because we have to understand that the cost of the disease rise many fold as you go from preventive care to primary care to secondary to tertiary, right? And it's not just the direct cost of the disease, it is the indirect cost of the disease that also cost you a lot. Like we've been speaking about diabetic retinopathy, right? So diabetes, if you detect in the primary stage when you're just about to become diabetic, only transforming your lifestyle and adding a bit of exercise, doing some dietary changes can actually take care of you, right? You don't need any kinds of medicines, or you don't need to take time off work. You don't need to change your lifestyle, right? So that primary disease cost is very low. But if you have diabetic retinopathy and you lose your eyesight, then the costs really shoot through the roof, right? Because those laser treatments and the treatments that you need, they cost lakhs of rupees in your eye. But now it's not just the direct cost of those lasers and those treatments that are 5 lakh, 10 lakh rupees. It is now you've lost your eyesight, so you can't really go back to work, right? Your job is gone. You're working in a factory, you're working in the fields or wherever. So you lose your job, the indirect costs now are in crores of rupees maybe, because your future earnings are lost for the next 20, 10, 20 years that you're supposed to work. You're not earning anything. And the most troublesome is the intangible cost of the disease no one is measuring, because now you're out of a job, you will pull your children out of school and start sending them to work, because somebody has to work to make the household run, right? So future many generations will be destroyed because you could not detect that retinopathy which AI could have detected in time, and you lost your eyesight. So these kinds of interventions will bring down the cost of the disease very rapidly. Even before detection, you can now do predictive medicine with AI, right? So you know that there are 70 million diabetics. Now you start understanding that data and analyzing that data, that these particular subsets who had these problems or who had these investigations that were not correct 5 years ago have now landed up into kidney failure or retinopathy or have a diabetic foot now, because those were the high risks that we failed to recognize. But now we are seeing that data repeatedly, that anyone who had this, maybe a creatinine level of 1.3, these were 10 times more likely to land up into kidney failure 5 years down the line. So you can do predictive analysis that this patient will land up into kidney failure, so now this patient needs much much higher care and much more stricter control of diabetes than the other, who, even though his sugar is 300, but he will not land up into kidney failure because he does not have these risk factors. So you will know who to target and how to target. So this predictive medicine will be a great asset to decreasing your costs in the long term. Also, personalized medicine. So right now, what we are doing, unfortunately, because we don't have those data sets and those personal reports and the analysis, right now what we do is, because a drug trial was done on the east coast of America, and that drug trial was successful. So we will say that, this was successful in a Caucasian 6 foot tall, meat eating, fair skinned person. So this drug will be successful on you also, even though you are just 5 foot tall, you are dark skinned, you eat fish and rice, and you live on the east coast of India. But because we tested this drug on that Caucasian and was successful, we'll give it this to you also. Unfortunately, we give the same drug to the entire world based on a drug trial that was carried out somewhere, which has no applicability to your lifestyle and your body structure here. This can be solved very easily through machine learning and AI, where we can actually do the drug trials on a much wider scale and much wider geographies without incurring that higher a cost. So personalized medicine, predictive medicine, and low cost medicine will have great opportunities going forward with the advent of AI and technology, which right now we are unable to do.
Right. I think I was so absorbed into listening to what the information that you were passing is so interesting, and I totally agree because these clinical trials usually take place uh, somewhere very far from India. And India is a bit behind in clinical research, and we all are aware of that. So I think with this benefit of having the highest populace in the world and combined with ML, we could come up with data sets and statistic analysis that will really help the predictive aspects of healthcare analysis. So I think it's been an amazing discussion, Dr. Sachin. Thank you so much for being here, and Mukesh sir, you as well. Thank you so much for your valuable insights and giving us, all the knowledge and busting the myths, of course, and giving us an understanding of, really AI is not going to take over, but somebody using AI will. So, endorsing the fact that yes, AI is something that we can look at as a future solution to all our problems. Thank you so much, both of you, for being here on our panel today. And you both have a good day. Thank you, audience, for joining. Signing off, and we'll see you again for the next live.
Thank you,
Thank you very
Sneha.
much.
Yeah.
Thank you,
Thank
Mukesh
you.
ji.
Thank you,
Bye.
Dr. Suchi. Yeah. Bye bye.